This is going to be one of my most real, raw posts and prayer requests. This is the face of cancer. I'm not saying that I am the face of cancer. I'm just saying that this is what it looks like um, for many people. And I'm sharing this morning because I am so overwhelmed, not just for myself, but for other cancer patients who are in this journey with me, who are going through so much that you have no idea about. So, this post is entitled How to Pray and How to Care for a Cancer Patient That You Know and Love. I'm overwhelmed this morning, not just because of this disease it has taken over my body and is trying to take over my life, but my life is about to change in many ways as a result of this diagnosis. I will now have to um, go on disability and be deemed disabled. Um, my work situation is about to change. I will not be able to work, and all that comes with that. You don't work, you don't earn income, your insurance coverage changes. I mean, I'm going to have to apply for state aid. And why am I sharing this? Because I have shared the rest of my journey so far, the good, the bad, the ugly, the pretty, the dancing, the prayers, the praise. But I have to share this part too, because this is the yucky part where people don't realize that cancer does more than affect your body, and treatments do more than try to take away your ability to live. So when you pray, pray for more than just healing. Pray for more than just strength. When you look around at the people you know who are dealing with cancer, pray for their ability just to live from day to day. Because when your body betrays you because of this ridiculous disease, your mind is still there, but your body doesn't allow you to do what you normally do. It impacts other areas of your life. It impacts the areas like being able to go to the supermarket for yourself. So sometimes I don't need a prayer. Sometimes I need a driver. Sometimes I don't need speaking in tongues. Sometimes I need a word of encouragement. I don't need to be preached to because I know the word, but sometimes I just need to hear, Shannon, we're here for you, or just to have somebody sit with me. And I'm saying this not just for me, but for the cancer patients that you know. It's knowing that this wonderful person who has worked for so long is now going to have to give up the ability to work. How do a young woman deal with that emotionally? So when you pray, pray specific, pray strategic. Think about the people who you know who are dealing with this ridiculous disease for years and years or months, as in my case, and go into your prayer closet, not just asking for healing, but asking for the ways to live daily, how to get by daily, how to be able to provide our basic needs daily, how to be able to make it with our body. Right now, I'm in the hospital on an unplanned admission. I simply went to the doctor a few days ago just for my regular routine visit, only to realize that my platelet is 5. And for those of you who have no idea what that means, it means blood, my blood, I don't have enough blood. Or I could die if I just hit my finger or bleed somewhere. So apparently somebody with normal platelet is 200 or above. Somebody in my case, normal platelet should be about 50. I am walking around with 5. You know what that means? It means that's how I need people to pray, because this disease and the chemotherapy is affecting other areas of my life. I'm now beginning to have what they call neutropenic fevers, which means it's not so much the disease, but the treatment of the disease that could mess up my body. Why am I sharing this? Because I have shared the other parts of my journey. And God forbid, I'm not going to hide the rough, raw, real moments too. So as you pray, pray that the Lord will give me and other cancer patients the ability to handle this journey every day, because it's hard, it's very hard, and it's heavy, but also the ability to meet our needs, the ability to deal with not being able to work. That in itself is like, whew, my mind, when I think about not being able to work and to have an impact
at the level I was able to. That is hard. Pray for our caregivers and our family members who are dealing with this. It takes a toll. We're all human beings. We're people who are going through and having to deal with the uncertainties and the difficulties. And it is not easy. I don't care how much we have faith in God. It is not easy. So pray for the caregivers and the family members and the children who are having to watch their mommies and their daddies go through this. Right now I'm thinking of a young patient who has become a friend of mine with a little child at 6 years old. A single mommy with a 6-year-old. What is she supposed to do? So when you pray, don't just tell God to heal, because it's more than just healing we need. We need more than healing. We need God to provide strategies. We need God to provide us ways to take care of ourselves and our families, to be able to handle this with wisdom and grace and dignity. Ask God to help us with the treatment that is meant to help us does not completely destroy us. And just pray as though it were you. When you pray, don't just pray pretty prayers. Get all up in your secret closet, get in your war room, and you pray like this was your family member. You pray like that cancer patient you see on the job or in your church lived in your house, and what that would feel like and what that would look like. When you have to walk around with masks on all the time because just breathing in other people's air could make you sick. Imagine what it would feel like if you had to sit in this situation. So don't just say, I'll pray for you. That's well and good. And one other point. I have now looked at missions in a different light. I am all for people wanting to reach across the waters and bless people's lives. We are supposed to do that. But having been in this situation, my heart now goes out to the ones who have been serving in churches for years, teaching our kids in Sunday school, playing in the band on Sunday morning, ushers in the pews who have been serving in our churches and are now no longer able to serve because they have been stricken with cancer. That's where my heart is. And if I will ever be in a position to bless lives, before I reach across the aisles, before I reach to foreign lands, I say, God, you have now given me a heart for the people in my church, in my life, who are needing me to be your hand extended. So, how to pray and how to care? Look around with eyes as if this was your illness, and consider what it is like when your life now changes because of a cancer diagnosis. Not just physically, but financially, emotionally, socially, and in every other way. I could not pretty this up for you this morning. So if this was hard to watch, I'm not even going to apologize, because the Lord said, get up and let people know exactly how to pray, so that they will look at other people in their circles and recognize what the real needs are. Pray for me now as I begin the next part of this journey, having to have a new status in life. They may say it's a disability and I am disabled, but I will manage it well, and I will continue to be who God has called me to be as my faculties remain intact. I am still the same Shannon here. I'm still all of that. But I just felt the need to get up and just tell you how to pray and how